We often take for granted how much our hands can do, from opening pickle jars to reaching into a pocket to grab some change. For people with a hand deformity known as Viking's disease, those seemingly simple tasks can become pretty big challenges. Dr. Michael Kim is here with us this morning to tell us more about Viking's disease and how to treat it. Dr. Kim, good morning.
Good morning.
What is Viking's disease? I had never heard of it.
Well, it's dupuytren's disease. In the first picture, it's very common. Probably about 4 to 5% of Americans have a form of this, and you can see that it's just a contracture of our fascia. So like on our feet, we have a plantar fascia. Our hand has fascia. It's a very superficial layer just under the skin. And it thickens, and we don't know why. It's genetic. So it's in our genes, whoever has it, but often it'll skip generations. So a lot of people have this, their family members don't have it. And they call it Viking's disease because it's very common among Northern Europeans, Scottish, Finland, all of Northern Europe, in addition in Japan also. So as you can see on the bottom, on the top left, it sometimes starts as little nodules. And I get a lot of patients come to the office and they're worried about a tumor and they have this little knot in their hand. And actually what it is the start of dupuytren's, or the Viking's disease. And sometimes it never progresses, and reassurance, telling patients nothing to do, don't worry about it, we'll watch it. But sometimes it does progress. You can see at the bottom, it shows the progression of having a little nodule, then a little contracture, and eventually where it becomes significant, where it affects your activities of daily living. It's very hard to do anything with a hand when it's flexed that much. So we can't predict which patients it will get worse, so we just watch it. The treatment, once it becomes significant where patients really can't do what they need to do, and that's really the indication for treatment. So in the last 10 years, they developed several other treatments other than surgery. Now surgery is obviously probably has the highest cure rate, although since it's genetic, it often will come back.
Oh, wow.
So you can see at the 5-year recurrence rate, meaning that there's another 30 degrees of contracture. Surgery still has about a 20% recurrence rate. The other two options is taking a little needle called a needle panotomy and just basically dividing the cord with the needle. It's a 20-minute office procedure under local, almost no downtime. The major risk is recurrence, and when you just divide the band, it's kind of like if you have a bent branch and just divide it a little bit and straighten it. The branch is still there, you don't cut it out. So the recurrence rate is somewhere between 50 and 80% at 5 years.
Is this something that if you begin to see that nodule that you should see a hand specialist directly, or do you go to your general practitioner first?
Well, you want to make sure it's not a tumor, so don't assume it's Viking's disease. But I would definitely see at least your primary doctor, maybe a hand surgeon, just to get reassurance and evaluation, because sometimes tumors can appear to be similar. The third treatment is Xiaflex, which is an enzyme that you can actually inject and dissolve it. And that's relatively new, probably in the last 5 years. I would definitely seek out a hand surgeon if you have this to see what your alternatives are.
All right, Dr. Kim, thank you so much. And more information on our website, winknews.com.